Hello, my name is Steve Kurthy. I'm a registered nurse. I am also a student pursuing my nurse practitioner. Today I'd like to discuss my community plan for DeBary, Florida. The topic for my community project is addressing childhood obesity within this community. Doing a community health assessment is used to identify the health needs of a chosen community through, direct observation of the community and data analysis. The goal of the assessment for this community is to identify the needs and help develop a strategy to address issues that are identified. Using these tools, the community plan will address the current issue of childhood obesity in the small community in Central Florida of DeBary, Florida. Definition of community. So as you can see here, understanding, defining your community is an important first step to assessing the community that you live in. Collecting assessment data will help you understand the community's needs, its strengths. Understanding the different people and the cultures and the resources that are available will all help you to better assess and define and serve the community you're trying to help. My main community here is Central Florida, also sometimes called Orlando. It's mainly all grouped into what is considered Central Florida. We're a very diverse group of cultures. They come from not only within the United States, but international as well. Choose Florida as a destination for living. So here I'm going to kind of present a general overview of my community of Central Florida and the neighboring Orlando area. The community has various cultural and ethnic groups, different population groups, all within, especially a large elderly population, since we are here in Florida. As you can see, the Orlando has a population of approximately 287,442, and the state of Florida itself is a little over 21 million. These are as of 2019. Orlando is the fourth largest metropolitan city in Florida, behind Jacksonville, which is number one, Miami, and Tampa. And of course, you can't have a conversation about Orlando without it being considered the theme park capital of the world because of Disney and Universal, as well as SeaWorld attractions, and most recently the Legoland attraction that has been built. As a result of that, we have many urban workers through all sorts of economic and poverty levels here. Orlando is built, mainly on the hospitality and entertainment service industries, with some agriculture that's on the farther outskirts of the city limits and more of the rural areas that you'll see. There are many well-known retailers and restaurants within Orlando and the Central Florida area, as well as numerous outdoor shopping here in Florida because of the weather. The Central Florida is also host to many different colleges and universities and educational opportunities for those within. Orlando and the surrounding Central Florida area is very robust in healthcare. This is due in part to a constant influx of people moving into the state, and Central Florida specifically. And as a result, hospital systems have had to increase capacity and create new services to meet the needs of the ever-increasing population. One of the biggest developments for us in the community over the last few years is to offer increased services and access to health care is the creation of standalone emergency departments. These are developed to increase patient access and decrease the time it takes to see a physician and start receiving that care. From there, they'll be transferred to a standing hospital that has a full array of services. There are many different types of people we have here in the Central Florida area. We have, as I said, a robust elderly population. It's a popular retirement destination with many 55 and up communities. There have been many new hospitals and standalone EDs that have been built around and in these retirement communities. The Villages in the Central Florida area is one of the more well-known nationwide retirement communities. It's all inclusive with a hospital and multiple standalone ERs that were built specifically to take care of that unique population area. As we know, part of this community's definition is that, it is a vacation destination for a majority of not only, local and national here in the United States, but also international as well. Orlando and Central Florida have a lot of cultural and diversity due to the different lifestyles, populations, races, different jobs, and the origins of our people from within the United States, as well as people coming here from international locations as well to live, work, and play. And as I said, Orlando and Central Florida area have proven to be very, very diverse and very multicultural, just because of the diverse group of people that choose to call this their home. We also have many different places of recreation, education, work, and healthcare. Moving on to the windshield survey, the chosen community for this project is DeBary, Florida. DeBary is a small little town located in Volusia County that's just outside the Orlando city limits and northeast of the city. DeBary is a quiet, well-kept mixture of suburban and rural living. The majority of houses and stores in the area suggest that the majority of the community's residents are middle to low income. The biggest challenge I did notice is the health of its residents. I observed the overwhelming majority of the population and the children were overweight to the point of obesity. I had also observed the many different, public recreational areas and parks that are available to the residents, and there were hardly anyone making use of these facilities. So again, the most pressing problem, that I had noticed is the low income mixed with obesity, inactivity, and fast food. One of the things driving through this community that you noticed is it is dominated by a lot of fast food and convenience stores. Very little access to what you would consider access to a lot of healthy food choices in this community. So moving on to community assessment, the population of DeBary as of 2021 is a little over 21,000 people within 25 square miles that makes up the town. Population density is about 1,100 people per square mile, and it does have a growth rate of about 13%, as it was recorded in 2010. There are many vital statistics available for this community, but currently the average age is approximately 48.7 years old, with 66%, 2/3 of that community are 35 or older. The average income of the residents is slightly below the national average, approximately 9.2%. The leading causes of mortality and morbidity in the community, in the county of Volusia, and with respect to the state, it shows cardiovascular disease being the leading cause of death for the residents. As we know, obesity tends to create cardiovascular issues, diabetic issues, and many other health problems. Significant trends in this community show that the population is below the national and state average in many areas, higher than normal levels of obesity compared to the rest of the state, as well as significant levels of diabetes and a higher BMI suggest a fairly unhealthy community. This kind of correlates to the data showing the leading causes of mortality and morbidity, where being overweight, diabetes, cardiovascular disease all come hand in hand. Also, the lack of local access to immediate health care. There's some local providers, but you have to go to the neighboring towns, about 10-15 minute drive to get to the actual hospitals to get emergency care. Okay, moving on to community partners and resources. The people I partnered with for this project are the owners and the staff of the DeBary Sunshine Academy and the Armored Academy. The Sunshine Academy is a daycare. Armored Academy is an after-hours care facility for the elementary school children. Both of these facilities are in the same building, and they are right next to the local elementary called DeBary Elementary School. It is a central place to address some of the needs of these children right there in the community. So the community partners that I'm working with are the owners and the staff of the academies. You know, the role of my project is, their role in my project is to support me in my project and give me access to their facility and the children as well as their parents. You know, we have a shared goal of improving the community. They're an invested shareholder because they'd like to see the health of the children in the community improve as well. Also because of they have a connection to a lot of the community leadership as well as some of the local providers, so we can all come together to make this a more successful project. There are multiple resources in this community to help augment this project. One of the major resources is the fact that this community, being in Florida, and the weather, has a large number of public provided outdoor parks and recreational facilities that is perfect for getting physical exercise and being active in the outdoors, especially in our climate here in Florida. You know, the Academy has a good, as I said, a strong connection to the local government as well as providers, so we can try and pursue that on multiple levels. So the town has many resources to help improve the health of the children. So the community nursing diagnosis for this health that I have, based on the assessment data that was observed and collected for the community of DeBary, Florida. So basically, this community health diagnosis is at risk of childhood obesity among the children in DeBary, Florida. And of course, this is related to lack of exercise and the use of public recreational facilities, you know, family knowledge, deficits in, you know, proper nutrition, portion size, meals, lack of access to healthy foods, and parental obesity. This was a major issue that I had noticed among the children as well as the adults. Now, moving on to the community health plan, these are some of the goals and objectives of my community project. You know, the parents, and my goals are for the parents and the children of the academies to verbalize an understanding for the need for adequate exercise and use of these public recreational facilities, both the adults and both the children and their parents. Another goal is for the parents and their children of the Sunshine and the Armored Academies to verbalize an understanding about the benefits of losing weight and dropping weight, as well as understanding, you know, the possible health complications that will come down the road as a consequence of being overweight, diabetes, which was another one of the goals of my plan, creating a PowerPoint project and discussing diabetes with the children and the adults with what we can do to stay away from this. Another plan is, you know, the parents and the children of the academies will verbalize an understanding for proper meal choices and nutrition. This is quite the challenge when access to healthy foods is not immediately available in the town. They have to drive to the next town over, but making those parents aware that a little bit more effort and both they and their children will have a much brighter future if we can, you know, narrow in on the proper choices of food to eat and the proper amounts of food. And lastly, both the parents and the children of the academies will verbalize an understanding of the health risks associated with obesity. And that, as I said before, comes into play with diabetes, cardiovascular disease, and all these preventable problems in the children that we can kind of prevent as a primary level of prevention. And then in the adults that are already having some challenges with being overweight, you know, maybe some secondary prevention to try and kind of help manage those issues a little bit better. Okay, moving on to some of the interventions, okay, for this project. We had partnered with the local daycare and the aftercare facilities. Again, these are located right next to the local elementary school there in DeBary, so it's a perfect location and a perfect partnership to get access to the youth of the community and try and make a change. The other thing that we did is we created a PowerPoint project for the children on diabetes to help create an awareness and we get a little education about how to kind of stave off this issue, exercise, proper nutrition, portion sizes, and this was also shared with the parents when they were dropping off and picking up their children if they would like to kind of share in the education, and I had gotten a very positive response out of this, and they wanted to participate in the learning as well because they wanted to improve their lives. The Academy has now added increased exercise and play time for the children, which is really excellent to help them start losing some of the weight. And the other intervention is, the sustainability of this project is through continued intervention at the facilities. So this PowerPoint project on diabetes and this increased exercise time and making the community and parents aware as something that can be sustained in this community. And the owners and staff have every intention and want to sustain this change because they have also noticed a dangerous increase over the years in the obesity of the youth of the community. So the community health plan intervention evaluation, some of the proposed plans I use to track these interventions is recording the initial height and weight of the children. With this, we can determine their current BMI. And on a weekly basis, we can track, obviously, the heights just to see how the children are growing and their weight. This progress will be went over with the parents on a weekly basis when they pick up their children. And, if things aren't going the right way for certain kids, we could go ahead and reinforce and modify some of these teachings for the children who might not be progressing as well or going in the wrong direction. So in conclusion, basically, effective and successful community programs will help prevent injury and disease, enhance the quality of life, and improve the health of the overall community. This assessment of this community showed a need to address childhood obesity, and partnering with the local daycare facility and aftercare facilities that's located right next to the local elementary school was an excellent opportunity to connect with the youth of this community and their parents to try and make a meaningful change in their lives and the health of the community. And by partnering with the local daycare facilities, we're going to be able to sustain these interventions and track them and provide for the future of this community. I'd like to thank you for your time listening to this presentation and wish you all the best. Take care.